Hi everyone. So, welcome again. It's third week, Saturday, third week, and we are discussing topic. It's you must have read it that what causes certain dispositions to cause a disease in a person. So let's go ahead and talk about it. So there are inherent susceptibilities that disposes us to certain diseases, certain conditions, and when Dr. Samuel Hahnemann was treating actively with homeopathy, he was treating a lot of patients, a lot of friends, family, and stuff. So while he was doing that, he observed that there are certain diseases, there are certain group of diseases that reoccur. Meaning, once they get a treatment, they feel better, followed by a couple of weeks, again the complaints come on, again they're complaining, they have same set of symptoms and complaints. Okay, so he studied this extensively for 12 long years, and he founded, or he concluded, that there is inherent susceptibility that is disposing that individual to certain group of diseases or conditions which we call as miasm. So another homeopathic concept which is called as miasm. So miasm is nothing but inherent susceptibility or inherent disposition that exposes us to chronic diseases, as we call today chronic diseases, or in modern day terms it's called as non-communicable diseases, NCDs. To define miasm technically, the technical definition of miasm is its inherent polluting exhalations or malarial poisons. So that's how technically miasms are defined as. And to just for understanding purposes, we define miasm as inherent susceptibility that exposes person to certain diseases. Now there are three types. This theory doesn't end here, but further on, this theory has three types of miasms classified in each way, like it's called the sora, syphilis, and the psychotic miasm. Okay, so these three types of miasm we'll be discussing each type in each separate video. My idea is to break down this topic into tiny videos or tiny topics. So we'll be discussing the theory of miasm every third week, because as you know, third week is for students, people who already know what homeopathy is but are interested in learning more about homeopathy. So that's why we'll be discussing the concept of miasm every third week, or third Saturday. Okay, so I will be doing a separate video on soric miasm, syphilitic miasm, and psychotic miasm, because there's lot in each miasm. There are lots of symptoms that need to be taken into consideration while we talk about sora, syphilis, and psychotic. So just to give you a brief intro about what sora, syphilis, or psychotic miasm are, sora is nothing but inflammation, initial stage of disease, or it's as it's termed, sora is mother of all miasms. Okay, meaning things start with slight fault, followed by degeneration, or followed by excessive damage to the body. Okay, so sora is very first miasm, and it's defined, or I just say broadly that sora means inflammation. Then another miasm is psychosis or psychotic miasm. It has derived from Greek word fig. So definitely you can tell that psychotic miasm means growth. Okay, so any kinds of fibroids, warts to cancer and everything comes under psychotic miasm. And syphilis, of course, is end stage of the disease, which is characterized by ulcers, perforation, bleeding, and types. Okay, so we will be definitely talking about soric miasm, psychotic miasm, syphilitic miasm as three separate topics, because there's a lot that needs to be covered. Okay, so if you are a student and you have recently started studying homeopathy, or if you're completely new homeopath and if you're experiencing some kind of failures in your practice, definitely go back, refer to miasms, read about it, and think what's going wrong with your patient and what needs to be done for your patient. And I'm sure you will be successfully able to treat your patient, and your patient will feel much better. So it's miasm that is causing your patient to come back again with same set of complaints. Just remember that. Okay, so we'll conclude today's topic with this. We learned about miasm, and I will see you first Saturday of next month. Until then, bye. You guys have a great Saturday. Bye bye.